Hi, I'm Susan Bealey, an HIM professional with the Consulting Services Unit of 3M Health Information Systems. Thank you for joining me. I'd like to take this opportunity today to present you with a brief overview of ICD-10. This will give you the framework in which to view one or more of the 19 specialty-specific ICD-10 modules that best represent your practice, whether that is cardiology, infectious diseases, or ophthalmology, for example. By now you have probably heard quite a bit about ICD-10 in the medical community. We'll spend a few minutes covering some basic facts. First, ICD-10 becomes effective October 1st, 2015. This means that ICD-10 codes must be used for inpatients discharged from the hospital or for any outpatient seen in your office, a clinic, the emergency room, or any other outpatient area on or after October 1st, 2015. ICD-10 was originally slated to go into effect 2 years earlier on October 1st, 2013. CMS issued a 1-year delay on August 24th, 2012 because of concerns that not all providers would be ready to implement by this date. Another delay occurred as a result of HR Bill number 4302, which was signed into law on April 1st, 2014. It delayed implementation of ICD-10 by at least 1 year. CMS issued a final rule on July 31st, 2014, finalizing the implementation date of October 1st, 2015 for ICD-10. Second, you might be asking, am I affected by the transition to ICD-10? The answer to this question is yes. All covered entities that transmit electronic data based on the Health Insurance Portability and Accountability Act, HIPAA, transaction standards must transition to ICD-10. There are 3 specific groups of covered entities that transmit electronic health information in connection with these HIPAA transaction standards. They are health plans, healthcare clearinghouses, and healthcare providers. Examples of health plans are Medicare, Medicaid, and private health insurance companies such as Blue Cross and Blue Shield. A billing service is an example of a healthcare clearinghouse. Healthcare providers are physicians, hospitals, clinics, and nursing homes, to name a few. Types of agencies that are not HIPAA-covered entities are workers' compensation and certain other forms of insurance, such as automobile or disability insurance. It is anticipated that most non-HIPAA-covered entities will choose to comply with ICD-10. Third, there have been many questions about the status of CPT in light of the transition to ICD-10. CMS has loudly and clearly stated that CPT is not being eliminated. You will use CPT to submit claims for any professional services you provide either in the hospital or your practice. Hospitals will also continue to use CPT to code hospital outpatient procedures. They will, however, use ICD-10 to code any hospital inpatient procedures performed. Lastly, you have probably heard that there has been a substantial increase in the number of ICD-10 codes compared to ICD-9 codes, and that these codes provide greater specificity and granularity about diseases and conditions that affect patients. It is true that there has been a significant increase in the number of ICD-10 codes, and these codes are able to capture a level of specificity or granularity that was not possible before. But remember, you use a limited number of all the ICD-9 codes available today, and that will still be the case in ICD-10. Additionally, your current documentation contains much of the detail required to assign ICD-10 codes. For example, when a patient sustains an acute myocardial infarction, you typically document the type of MI, either STEMI or NSTEMI, the wall of the heart affected, anterior for example, and the coronary artery involved, such as the left anterior descending. All of this information was not needed to code an acute myocardial infarction in ICD-9, but it is needed in ICD-10 and is already being documented in the medical record by you today. The coder will capture this documentation and use it to assign the ICD-10 code for the myocardial infarction. If your documentation happens to be unclear or is lacking an element needed to assign an ICD-10 code, it may result in a query to you from a coding or clinical documentation improvement professional. You should also know that there are many diagnoses that have no new documentation requirements in ICD-10. An example of this is the diagnosis of congestive heart failure. The ICD-10 terminology describing CHF remains essentially unchanged. You will still need to specify whether the patient's congestive heart failure is acute, chronic, or acute on chronic, and whether it is systolic, diastolic, or a combination of both. In the upcoming specialty-specific ICD-10 modules previously mentioned, you will learn about ICD-10 documentation requirements for the most common diagnoses used by specialty, as well as documentation requirements that are unchanged in ICD-10.
You may have heard that physicians, and for that matter coding professionals, really do not need to learn about ICD-10 because there is mapping software available that can convert an ICD-9 code into an ICD-10 code. Well, that is true. There is a translation tool that is called General Equivalence Mappings, also known as GEMS. The GEMS were designed to be a translation dictionary of sorts to convert ICD-9 codes to applicable ICD-10 codes and vice versa. GEMS are intended for use, for example, by a hospital to convert historical data to ICD-10 for the purpose of comparison and trending of data over time. It is important to keep in mind that sometimes there are not exact matches between ICD-9 and ICD-10. In these cases, the GEMS provide acceptable translation alternatives that may not exactly match medical record documentation for each case. This is why the GEMS cannot be used as a substitute for the coding of medical records effective October 1st, 2015.
Now that we have covered some of the basic facts about ICD-10, let's spend a few minutes talking about the structure of ICD-10 itself. The official name of the ICD-10 coding system in the United States is the International Classification of Diseases, 10th edition, Clinical Modification Procedure Coding System, which is usually referred to as ICD-10-CM and ICD-10-PCS. Because even that is a mouthful, some will simply say ICD-10 or I-10. ICD-10 consists of two parts. ICD-10-CM is used to code diagnoses in any setting, and ICD-10-PCS is used to code inpatient hospital procedures. The format of ICD-10-CM is similar to ICD-9-CM with a few key differences. One difference is that an ICD-10-CM code has 3 to 7 characters, where an ICD-9-CM code has 3 to 5 characters. Here are a few examples of codes for you to review. What stays the same is that the decimal point is still placed after the 3rd character of the code. In ICD-9-CM, the first character of the majority of codes is numeric, with the exception of E codes, which represent external causes of injury and poisoning, and V codes, which represent factors influencing health status and contact with health services. What's different in ICD-10-CM is that the first character of all codes is alphabetic. All letters of the alphabet are used with the exception of the letter U. On screen, you will see ICD-9-CM codes and their ICD-10 counterparts. Note the first alphabetic character of each code. The first character is not case sensitive, but you will notice that the first character is almost always written or printed as an uppercase letter. In ICD-9-CM, the 2nd through the 5th characters of a code are always numeric. What's different in ICD-10-CM is that the 2nd character is always a number, and the 3rd through the 7th characters can be a combination of letters and numbers. You will note this in the codes on screen. There are some new coding concepts associated with ICD-10-CM that you will learn about in the upcoming specialty-specific modules that you will review. Where ICD-10-CM has a very similar look and feel to ICD-9-CM, an ICD-10 procedure code bears no resemblance to an ICD-9 procedure code. A significant difference between the two systems is the increase in the number of characters in an ICD-10-PCS code. An ICD-9 procedure code was 3 to 4 characters long. In ICD-10, it is a full 7 characters long. And what's more, all of those characters are alphanumeric, where in ICD-9 they were all numeric. We'll talk more about those characters in an upcoming slide. Lastly, no decimal points are used to punctuate a PCS code. If you deal with ICD-9 procedure codes at your local hospital or for research projects you may be involved with, it will take your eyes some getting used to the new format for PCS codes. ICD-10-PCS has a multi-axial code structure. Each of the 7 characters, or axes, maintain their meaning across the coding continuum. For example, the 3rd character in a PCS code represents the root operation, which is standard across all PCS codes. As previously mentioned, an ICD-10 PCS code consists of 7 alphanumeric characters. The numbers 0 through 9 and all but 2 letters of the alphabet are used. The letters not used in a PCS code are O and I, in order to avoid confusion with the numbers 0 and 1. Each of the 7 characters of a PCS code represent an aspect of the surgical operation or procedure, and they all come together to tell the whole story. Let's do a quick review of the 7 characters found in the medical and surgical section of PCS. It is important for you to be aware of the components of a PCS code because the coding professional will be looking for the information about them in your operative report or procedure note in order to assign the PCS code. The first character of a PCS code identifies the section where the code is located, which represents the broad category of procedure. There are 16 sections within PCS. Examples of sections include medical and surgical, obstetrics, imaging, and placement, to name a few. The majority of procedures are classified in the medical and surgical section. The code on screen is located in the medical and surgical section. The second character in the code represents the body system, either the general physiologic system or the anatomical region on which the procedure is performed. In the example on screen, the body system for this code is the hepatobiliary system and pancreas. Character number 3 is the root operation, which describes the actual physical procedure or operation performed on the patient. The root operation identifies the objective of the procedure. There are 31 root operations in PCS. The coding professional must read the surgeon's operative report to determine which root operation or operations have been performed. Examples of root operations include excision, bypass, and reposition, to name a few. In the code example you are viewing, the root operation is resection, which means that the surgeon is cutting out or off all of a body part without replacing it. The specific anatomic site where the procedure is being performed is identified by character 4. The body part, along with the body section represented by character 2, provide the exact location of the procedure. In this case, the body part is the gallbladder, which is located in the hepatobiliary system. The 5th character in the code explains the approach the surgeon took to reach the site of the procedure. In the example on screen, the surgeon uses a percutaneous endoscopic approach to reach the gallbladder and remove it. There are 7 approaches associated with procedures in the medical and surgical section of PCS. If a device such as an artificial hip joint or a pacemaker is left in the body at the end of surgery, the 6th character of the PCS code will identify this. Items left in the body as part of the procedure, such as sutures, staples, or packing, are not considered to be devices. In the procedure on screen, no device was left in the patient after the gallbladder was removed. The 7th and final character of a PCS code is called a qualifier character. It describes additional, unique attributes of some procedures. Depending on the procedure performed, there may or may not be a qualifier for the procedure. If there is no qualifier, there is a default value indicating that there is no qualifier associated with the procedure. On screen, you are seeing the PCS table where the code for laparoscopic resection of the gallbladder is located, as discussed on a previous slide. Note that the values for character 1 through 3 are listed at the top of the table. PCS tables have 4 columns that contain the values for characters 4 through 7. Note the location of characters 4 through 7 for the resection of the gallbladder procedure. Many of the terms used to create a PCS code are defined within the PCS classification itself, such as the root operations mentioned earlier. You will not have to change the terminology you use to document your operative report or procedure note in order for a PCS code to be assigned. It is the responsibility of the coding professional to read through your operative and procedure notes and determine what the documentation in them equates to in the PCS definitions. If your documentation is unclear or missing a key element needed to assign a PCS code, you will be asked by the coding or clinical documentation improvement professional at the hospital to provide clarification and/or supporting documentation. The transition to ICD-10 is a major undertaking for providers, payers, and vendors, involving major devotion of staff time and financial resources. Preparation for transition to ICD-10 is occurring across the spectrum. For example, hospitals, clinics, emergency rooms, and nursing homes where you take care of patients are implementing processes, updating systems, and training staff to support ICD-10. The payers that you submit claims to are preparing their IT systems to pay claims in ICD-10 and are making their medical policies ICD-10 ready. Billing services, clearinghouses, and practice management software vendors are preparing their systems to support ICD-10 as well. You have just participated in an ICD-10 preparation activity by receiving an overview of ICD-10. You will learn more about ICD-10 documentation requirements and nuances specific to your specialty in one of the upcoming specialty-specific modules. As a physician, you will likely be engaged in more ICD-10 preparation and transition activities within your practice and with the organizations you are affiliated with in the coming months. If you would like to learn more about the ICD-10 code set and/or ICD-10 documentation requirements, contact a member of your hospital's coding staff in the Health Information Management Department or one of the clinical documentation improvement specialists that is a part of the hospital's CDI team. In addition, here are a few online resources that you can access to learn more about ICD-10. Thank you for joining me today, and good luck with your ICD-10 transition.